Hi, everybody. Dr. Debunk here, doing another session of the Dr. Debunk Show, debunking medical myths, garbage, and crap spread by doctors and other health professionals. And this will be a good debunking on hormones. So I realized last video that I haven't done anything on testosterone, which is a huge growing problem in modern society, as is estrogen for women. I got to do that too. I don't think I've done one. But I'll do that for you too, ladies. But testosterone is relevant for both men and women. Um, More important for men. Well, not more important, but more dominant, just as estrogen is more dominant for women. But as I've said in my other video, if you haven't seen it, you got to watch that one too. It's on thyroid, and it's called Fat and Tired, and I think that's where I do it. Anyway, um, hormone therapies are absolutely mutilated wrongly by doctors because we study disease, which is in the gutter of human health, and we've thrown hormones into that. We don't study hormones from a point of view of optimal. Well, I don't want to have even normal hormones. I want to have optimal. I want to have the best testosterone level of the healthiest 69-year-old guy that ever lived. Well, guess what? I don't. So I have to supplement. But medicine is down in the gutter of disease, and I go into great depths. You should, to get the details, watch the Fat and Tired Thyroid video. And then I do have a PowerPoint I did. I've got to get that over to this. It's just hard for me to transfer it from my old computer. Anyway, the problem is doctors are down here. We have minimal, mild, moderate, severe, and extreme deficiency. And we see that with thyroid or, say, testosterone, low testosterone disorders. But then you could be normal, which we are most guys until 40. And then you can be optimal, and then you could have high levels, but the only time men get high levels of testosterone is if they supplement. And of course, knucklehead weightlifters that look like gorillas, they're abusing their body with taking massive amounts, which I don't recommend. But supplementing with hormones is the goal is to be optimal. So that's kind of an introduction. Well, what's the main function of testosterone? Well, all hormones are signaling molecules that have powerful effects on the human body. They are undoubtedly the most powerful substances in the body because they determine and control so much. And so testosterone is basically in charge of mental motivation, physical strength, and sexuality. And for both men and women. But men have so much more, and that's why we're so sexualized. Every woman knows men in their 20s are horny as dogs, you know. And some women, I have patients, women, that they have the sex drive of any man, and there are some studies, implications, blood levels that these women have way more testosterone than the average woman. Athletes, female athletes, have more intracellular testosterone. That's why they gravitate towards physical stuff because testosterone. I mean, you see some women that are a bigger woman. I don't mean fat, but they are whatever 5'6", 5'9", and they have kind of a normal muscle mass, but they are incredibly strong, and that's this testosterone effect. So for men who are used to it our whole lives, when we start to get low, we obviously change. So testosterone is about mental motivation, physical strength, and sexuality. Now, male sexuality is more complicated than we thought. With age, men become more like women. We do. When we're young, we have so much testosterone and the other factors. I personally believe there's another hormone out there that we haven't even discovered, or other factors here that determine male sexuality. There's a missing link here, and I won't get into why. But when we're young and raging, that's why we are so sexualized and are so aggressive in pursuing it. Anyway, but mental motivation is generally the first thing that drops. So what people think is that when men start to have problems with erections and sexuality, that really isn't the first sign. It can be, but generally it's motivation. It's like, how does a man know he's low in testosterone? How's your mental motivation? And the best thing, since men are doers, we love to do stuff. So we work because we have to, But then we want to do the stuff we enjoy. And so one way that's manifested is in personal hobbies, whether you like fishing or doing sports, or ideally your personal hobbies are with your kids. But, regardless, when you start to not want to do it, when men just come home from work and sit on their butt and watch TV, and they got these projects in the garage they like to do, they want to do, and they don't do it, if you're in your 40s, that's low testosterone. And that's what, as over the last 30 years, I've been aware of it and watching. It's epidemic how young men are getting and running out of testosterone. The first 10 years as a doctor, never treated any male in his 30s for testosterone deficiency. It's getting into the 30s. But so many men by 45, they are obviously low by how their symptoms are. And sometimes younger men can take it for a few months, 6 months, and then supplement with a precursor called DHEA, which I'll talk about. And then you can do fine. But basically, all people eventually run out of hormones. There's a very small percentage of people that will just crank out hormones their whole life. And I've talked about this in the other video. But everybody else at some point, if you get old enough, you're going to need to supplement. Anyway, I did the estrogen video on women. I totally forgot. So, but that was addressing the fake breast cancer, but I talked about it. Anyway, so for testosterone function, you don't wait for blood tests to be low. And so that's the next topic. In mainstream medicine, we use blood tests to determine if you're low on a hormone, and it doesn't work. As I've said many times, hormone levels of blood test hormone levels don't correlate with tissue levels. And it is proven scientifically, but it's more in research medicine, not clinical medicine. And doctors don't want to do it right anyway, because for me to know if I should treat you with testosterone, I have to ask you questions and do a lifestyle analysis. Well, I don't want to do that. I just want to give you a blood test, and kick you out of the office. So if you go as a male, 40 years old, go to your doctor and say, yeah, I'm kind of feeling weak and not motivated, they'll say, stop talking. Here's a blood test. We'll like your testosterone. And if it's really energy, it should be thyroid. But doctors, honestly, probably don't even like to do thyroid tests anymore, because they know that the test will be normal, even though you're giving them every low thyroid symptom in the book. And now it's the same with testosterone. Men are saying, yeah, I'm not motivated. I feel weak. I don't want to work out in the gym. My wife can dance around naked and nothing happens. Okay, that's low testosterone. So they get a blood test, and testosterone will drop sooner than thyroid, for lack of a better scientific, objective science. Minimal, mild, moderate, severe, extreme. So severe deficiency of thyroid, which means you're tired every day, sometimes in the morning, you have multiple other low thyroid symptoms. That's when your blood test will be below normal. And then they'll give you the crappy thyroid called levothyroxine, and it won't really help you if you're over 40. Well, testosterone, minimal, mild, moderate, more like moderate, a little sooner it drops down. And so sometimes the test is helpful. But the bottom line with hormones, all of them, you have to treat symptoms. As doctors, you have to treat symptoms. And you use blood tests to make sure you don't give people too much. It's really that simple. But we don't want to do it. You're not going to get that from mainstream doctors. They don't care. If the blood test says you're a green Martian, I'm going to give you an anti-green Martian pill and on your way. It's absurd how we don't care what patients say, and the blood test is magical and whatever it says, or the MRI or whatever. So if you suspect you're low in testosterone, it's because symptoms. Your motivation is obviously less. It usually changes over 6 months to a year. Why it takes that long is a complicated thing. You notice you just don't feel as strong. You go work out. Men like to lift weights and we'll do weights more than cardio. And you see like it's harder for you to do it, what you've been doing. Maybe you got away from it a while and get back to it. And then you see a change in your sexuality. The ability to get erections, hard erections, But sexuality for males is visual. We are visual creatures. Women, it's auditory. Guys, if you don't know this, if you want to rev up your wife or girlfriend, it's what you say to her. Just go watch Hallmark movies and take bits from a bunch of them and do it to her. Literally, if you want to take her away on a weekend, you know, is just do a bunch of Hallmark stuff for a whole day, and you're not going to have to beg her for sexuality at the end of the day. But men, we don't need that. All your wife or girlfriend's got to do is strip, and that's it. But we change with age. And so, anyway, when you see that, signs of low testosterone. So, your doctor will probably want you to get a blood test, but even if it's low, or a little low, or even normal low, here's the question you got to ask your doctor, guys. Well, isn't it lower than it should be for my age? I mean, when your testosterone is essentially in the quintile of a 70-year-old and you're 42, that's not normal, at the bottom end of normal. And so if you squeeze them, you can maybe get them. But if you find a doctor that does a lot of hormone therapies, if you have the symptoms, he'll give it to you. Now, I'm going to tell you the correct way to do it, because the way they're doing it is stupid. And why is it stupid? Because it's disease-based. We're not trying to make you deal with disease here. Nobody chopped off your testicles and you're doing replacement. Although we do the same way with that, you know. So it's not like women where the doctors chop out their ovaries because, ooh, it's another surgery we can do. Millions of women got hysterectomies with their ovaries in the 1960s, 70s, and even 80s. Should have never had it done. It's criminal. Anyway, little side thing. So if you're going to supplement, they have topical creams, they have patches, and those are fine. I'm not a fan of them. I think there's an easier way to do it, but then you'll have to get your doctor to do it for you. And I'll tell you. Oh, all right. My sleep nemesis. Someday I'm going to solve my sleep problem. Anyway, that's just me whining. Don't listen to me. Okay. So, I'm coming up to you, ladies. I haven't forgot about you. So, you could do those. The downside of daily supplementing of any hormone is you're suppressing your own production. Now, it's a natural byproduct of hormone therapies. We can't get around it. But testosterone is ideal to do burst therapy. You do it 2 days a week, not every day. And you don't do the one big once a week shot, which is what the standard. If you're doing the shots, guys, you know your doctor's giving you a dose every week. The problem with it is the day you do the shot, you're crushing your testicular production. They're not making any, and it takes them days and days to come back. And that's why we try to get away from it. Plus, we can supplement with DHEA to boost production. And so it's a better model to do intermittent therapy. So let me jump backwards. So guys, if you're in your 40s, especially even 30s, and you start to have these symptoms of low testosterone, go get sublingual DHEA. I don't care where you get it, but it's got to be sublingual. You can't swallow it whole. DHEA is a very common supplement. It's one of the more common supplements out there. Most of the products are tablets or capsules. Your stomach acid wipes out an unknown amount of it. Your first pass elimination in the liver wipes out more. So it should be done sublingually. So the product company, I've said it before, that I like is Source Naturals. Oh, no, I'm sorry, not them. Another company, Superior Source. And again, I don't know who owns it. I don't have any stock. I don't care. Superior Source, to me, is the best vitamin company because they make all sublingual products. I've used their products for 15 years. I like them. I'm on them. And again, I don't make any money. I'm advertising for them. I don't care. I want you to get the result. So they make these 50 milligram DHEAs. Now, a number of studies have been done that show us how to dose. We rarely have medical studies that help us in this quest of human health because they're disease-based studies. But in this case, you can do 250 milligrams of sublingual DHEA 2 days a week and have a measurable increase in testosterone blood test. 3 studies have shown it. It's enough information. I've been doing it. I've done my own study. I don't know how many hundreds of patients I've had that have done follow-up blood tests. And the only thing we changed was DHEA, and they have more testosterone, and it solved the problem. Now, it works the best for young people, so you don't have to go on testosterone. So a way to boost testosterone naturally is with DHEA therapy. Now, I do not recommend people males without symptoms doing this because you're affecting your testicles in a long-term, possibly negative way, and you don't want to do that. So don't do it, but it's just like the muscle building thing. I get it, all you 20-year-olds or 30-year-olds, even 40-year-olds. Men love their muscles and we want to have all we can get, but you can't do artificial stuff. You are stealing health from your life when you get older. Ask Ronnie Coleman. Ask Arnold, although he's a pathological liar, so I wouldn't believe anything he says. But Brad, whatever his name is, who's dead, Lyle Alzado. I mean, there's, you can't take these mega testosterone levels without a consequence. So guys, this is a side thing. You can do the protein powders. I'll do a video on it. There's some good science about how to do that. You can do creatine and protein powders, and build more muscle mass. And you have to be happy with what you can do. I mean, in your 20s, you can lift weights 5 days a week. In your 30s, 4, without hurting yourself. And whatever you end up, you just have to accept it. I know you want the look of the knuckleheads doing the synthetic testosterone, whatever, rhinoceros testosterone, basically. It's not worth it. You're going to be an old fart like me someday. Thankfully, I never got into that because I would have been a maniac like everybody else. Anyway, I pay enough for the crazy sports stuff I've done with my neck and knee and shoulder and stuff that I didn't have to have. I could have done sports. I didn't have to do psycho hang gliding, rappelling rock, crazy motorcycle racing stuff. And now I pay for it. But thankfully, resveratrol overcomes some of this stuff. Anyway. So, young men, you can try the DHEA. I'll say it again. It's called Superior Source. That's the brand. You can buy it anywhere. It's DHEA 50 milligrams sublingual tablets. You do 250 milligrams 2 days a week. So Saturday and Sunday are great. And then give it a month, 2 months, and you'll see the maximum benefit. And if it's working well for you in your late 30s or 40s, you're good to go. And then as you get older, if it's late 40s, then I usually I try to put my patients first on DHEA. And then the next step would be testosterone therapy. And what I do with that is, the problem is taking a lot of testosterone 1 day a week is bad for your own production. So how do we get around that? Well, take less and spread it out over 2 days. But nobody likes the shots because testosterone's in an oil base. You got to use a 21 gauge needle, and nobody likes those getting stuck into your butt, or stick it in your leg, but it just hurts and it's annoying. So sublingual testosterone, like almost everything, absorbs well in the mouth. It does. And so what I do is I give my guys injectable testosterone, and then I tell them, and I give them the syringes and needles, draw it up, take off the needle, and put it under your tongue. But you have to keep it there for 60 full seconds, swish it around, and you'll get the benefit. 90+% of it gets absorbed. So it's almost as good as a shot. And it's cheap because so many people make testosterone cypionate that even if you pay cash, you can go with that good RX coupon and for $35 get like a 4-month supply of testosterone. So it's literally $10 a month, And it's, I think, easier than the creams and the patches, but you can do that stuff. The problem is, what I do if men want to do the patches, then I double dose the patches and see if they can do it 3 days a week and be off at 4 days. And then you also take DHEA. So if you're doing testosterone, what I typically do with my patients is they do it Monday and Tuesday, and then Saturday and Sunday they do DHEA to turn back on their testicles to make them go more. Because see, the Monday and Tuesday shots are suppressing your testicular production. And so by Saturday, the body is running out of the shots you gave of the sublingual testosterone Monday and Tuesday. So the body is like saying, hey, we need more testosterone. By feeding DHEA to your testicles, which will suck up most of it, you increase your testosterone output from your testicles, and voila, I've been doing this 10 years. It works great. It's great. It's inexpensive. And then we use blood tests to make sure you're not taking too much. The blood tests are really not necessary. You got to treat symptoms. But they're necessary for treatment, not diagnosing. It's two different things. Doctors mix it all together, but it's not. What do we need to have with both medical testing and symptoms to diagnose somebody with a condition. And then treating is different. Treatment is where hormone blood tests are very important because it's easy to give people too much. And it's not really doing you any good. And it gives side effects, but they're not really significant. You know, they're trying to talk a little bit about, well, excess testosterone could predispose you to cancer. Lie. There are no studies to show that. Just like the estrogen thing, and I did that 2-part study for women. There are no scientific evidence. Not one study has ever been done that was done correctly to prove or show that estrogen can predispose you to causing breast cancer. Now, whether or not estrogen therapy would accelerate the cancer growth, that's up for debate. But treating cancer and causing it are two different things. Medicine's trying to make it one thing. It's not. So that's how it goes for men. Now, for ladies, if you're on estrogen, or even if you're not, but it's better to be on it, you can take DHEA and your adrenal glands and ovaries even will make more testosterone. And so women can take just 25 milligrams. And this is mostly menopausal. I don't really recommend women before menopause taking DHEA. I don't think you need it. Now, of course, there are exceptions, but I'd have to see you as a patient. I couldn't analyze. I can't give you a model that would be acceptable medically. See, everything I'm telling you, and here's my little disclaimer again. Remember, everything I'm telling you is for educational purposes. You have to clear it with your doctor. I'm telling you what I do with my patients. And so you're not my patient, so it might not apply to you. Your doctor has to analyze if he thinks I'm a crazy doctor or not a crazy doctor. And then you have to decide with him whether you're going to do any of these treatments that I say as Dr. Deepak. Because this is medical education. That's all it is. You know. But if you've seen me, then you're my patient, and yeah, go at it. But anyway, assuming we've talked about it as doctor-patient. But so women in menopause are losing strength and sex drive, and mostly that's estrogen. But my women that take estrogen replacement therapy and DHEA, they're happy as little clams. Because when you're taking estrogen, it's one enzyme reaction to go from estrogen to testosterone. These hormones dramatically change. There's no hormone in the human body that will dramatically change the body the way these two hormones do. So a male can take massive amounts of estrogen and begin to make himself look like a female. And anyway, and women, same thing. A woman can transform her body to a degree, but it's one little chemical reaction and one little carboxyl group, if I remember right, that changes. And yet it has such a powerful effect. And so if you're taking estrogen as a woman, you're blocking DHEA's ability. See, DHEA makes 6 hormones. I didn't tell you that. 6 hormones. Estrogen and testosterone both come from DHEA. So if you're blocking the doorway for DHEA to go into being made into estrogen, then it's preferentially going to become testosterone. And it absolutely works. So you can take a low dose, 25 milligrams daily, because you can take it every day because it's not going to mess up any other organs at that dose. You'll make a proportional amount of testosterone. Women need a lot of estrogen and a little bit of testosterone. But in menopause, you don't have either one, but estrogen is affected more. So by getting that up here, you can raise your testosterone with DHEA. It works so good. It's one of the easiest hormone supplement patterns I do. It's just I love it because it's so easy and women love it. They feel good. It's cheap. It's inexpensive. So ladies in menopause or near it, you can supplement that way. And it's the same company. It's called Superior Source, and it's 25 milligrams. You can get a bottle of like 100 for $12 or something. So, and some women can do fine just 5 days a week. So you can get almost 3-4 months out of a bottle. I mean, anyway. So that's pretty much it. I see no downside to testosterone therapies. I don't believe in any of this cancer risk. I already said that. It's just getting the dose right. It takes time. Difficulty finding a doctor. That's going to be your hardest thing. But, I forgot. I'm going to have to start saying this. I just found out that the government's crazy. They're absolutely certifiable, but we're stuck with these people. So state laws govern medical licenses. So I can only practice medicine in California. Oh, but wait, COVID changed everything. So if I want to open an office in Arizona, I have to get an Arizona license. And it's a pain in the butt and the money. And they're making this universal thing where doctors can have license in multiple states, but it still costs money and it's a pain in the butt. Oh, but they just redid the telemedicine laws for most states. And so even though I can't physically, this is how crazy this is, I can't physically open an office in Arizona, I can do telemedicine in 47 states, including Arizona. So that means, and you know what the laws are stating? That it's up to the doctor to use the medical standard of practice policies, or what is the medical standard of practice for each condition, to determine if it's relevant to do a telemedicine visit. So I can see any of you in 47 states. I can't see Alabama and I don't know, 3 states, what they are. You have to look it up. But, well, we have it here. But I'm not ready. Well, I haven't thought about it, but you can call my office. Well, I'll do a whole video on this. But basically, I'm going to be able to, I'll do hormone therapies over telemedicine. They are safe. I just need to know your history. I don't have to do a physical exam other than what you tell me. And people are honest with their health. I don't expect you to lie to me. It's, oh yeah, I'm dying of cancer, but I want to do this hormone therapy. Who's going to do that? So there's all these conditions, and the hormones is the big one that I can do now with these telemedicine rules, and I'm working on this project. And so those of you that are in other states or whatever, there's a number of different health therapies I can do for you that have to be done by doctors, but you can't get your doctor to do it. And hormones is the biggest one. So, oh yeah, it just hit me. I need to get this done. So anyway, that's it. That's the video on testosterone therapy. That's how I do it. After being 40 years as a doctor, I think it's the best way to do it. And thanks for watching. I'm Dr. D-Bum.